Hi everyone, I'm Marc Bates. I'm a metabolic health coach, and this is one of my highlights presentation. And the topic is unlocking the true predictor of heart disease. We're going to highlight that. All right, the blood test that predicts heart disease better. Did you know that medical schools spend 4 years teaching doctors to focus on cholesterol? They spend less than 20 hours teaching nutrition. The result? Physicians obsess over LDL numbers while missing the real predictor of heart attacks. Fasting insulin predicts cardiovascular events 6.7 times better than cholesterol levels, yet most doctors never order this simple test. The metabolic crisis that's hiding behind normal cholesterol. Less than 7% of American adults have good cardiometabolic health, according to research from Tufts University. The remaining 93% show dysfunction across blood pressure, blood sugar, cholesterol, and body composition markers. These patients receive clean bills of health because their cholesterol looks acceptable. Meanwhile, elevated fasting insulin quietly drives endothelial dysfunction, arterial inflammation, and arteriosclerosis years before glucose levels become abnormal. The Helsinki Policeman Study tracked 970 healthy men for 22 years. Hyperinsulinemia predicted coronary heart disease independent of all other risk factors, including blood glucose. Conventional medicine treats the smoke while ignoring the fire. 3 markers that matter more. Forget LDL cholesterol. These measurements reveal actual cardiovascular risk. First is fasting insulin levels. These should remain under 10, preferably even lower. Elevated insulin drives arterial inflammation decades before other markers become abnormal. Your triglyceride to HDL ratio often reveals metabolic dysfunction before standard tests. Research shows this ratio may be stronger than insulin resistance measurements for predicting cardiovascular events. And finally, the HOMA-IR index. This quantifies insulin resistance more accurately than fasting glucose alone. Values above 2.5 indicate significant metabolic dysfunction. Now, these markers respond to lifestyle interventions. LDL cholesterol responds primarily to genetics and medications. So, why medicine ignores the evidence? The barriers go deeper than medical education gaps. Pharmaceutical companies generate billions from lipid-lowering drugs. Lowering insulin through dietary intervention generates no prescription revenue. Billing codes reward procedures and medications, not time-sensitive lifestyle counseling that actually reverses disease. And billing codes are part of the whole thing of the health insurance industry and the Obamacare, all combined on what your doctor is doing. Okay, guidelines from major medical organizations have built decades of recommendations around the cholesterol hypotheses. Reversing course would expose massive institution liability, right? No one wants to get sued for fraud. When patients implement carbohydrate restriction, fasting insulin typically drops 30 to 50% within 2 weeks. Triglycerides plummet, HDL rises, which helps that ratio, and inflammation markers improve. No statin produces comparable metabolic improvements. The paradigm shift already underway. Thousands of physicians now train in metabolic approaches through organizations like the Society of Metabolic Health Practitioners and Virta Health. And I'm a member of the SMHP. Patients share transformation stories across social media platforms. Continuous glucose monitors allow real-time metabolic feedback without medical gatekeeping. Forward-thinking hospital systems integrate food-first metabolic reversal programs. Employers fund metabolic health initiatives to reduce healthcare costs. The economic case for metabolic healing has reached corporate boardrooms. Okay? So take control before your next physical. Request these tests at your next appointment. Fasting insulin, HbA1c, triglycerides, HDL, high sensitive CRP, and liver enzymes. Oh, and by the way, did you realize that almost everyone can order their own meds, their own lab work, and you can get it and then send it to your doctor later on when you're ready to? You don't have to go to your doctor's office to order meds for the most part. Focus on the root cause rather than accepting symptom management. Cut refined carbohydrates and industrial seed oils. Prioritize protein and whole animal fats. Track your triglyceride to HDL ratio monthly. Measure waist circumference regularly. Your metabolic health determines your future far more than cholesterol numbers ever will. The medical establishment resists this paradigm shift because it threatens the prescription-centered model of care. Become your own advocate. Cholesterol is contextual. Insulin is central to everything. All right. Hey, I want to thank you for watching. If you have any questions, any comments, please leave them in the appropriate section. If you have an idea for something you want me to cover in the next video, please leave that there so I can see it and we'll work on it. And as always, please like, subscribe, and share this video if you haven't done so already. It does help the channel a great deal and I appreciate it. Thank you.